Welcome to week 10. This week there is a quiz in the form of short answers and long answers. They should be done in point form. Please use point form. You will have the week to answer the questions. No extensions will be given. After completing the quiz, which includes weeks 1 to 9, begin your readings for week 10. This week's topic is therapeutic communication. As you are listening to the video, consider examples in your workplace setting, how to effectively use I statements. The goal is to be assertive, not aggressive. Therapeutic communication is necessary to develop rapport with your patient and family members. I'm going to use a nursery rhyme to convey the importance of communication. Jack and Jill went up the hill to fetch a pail of water. Jack fell down and broke his crown, and Jill came tumbling after. Body language and intonation can change the meaning of words. Let's use the rhyme again. Jack and Jill went up the hill to fetch a pail of water. Jack fell down and broke his crown, and Jill came tumbling after. In the second example, the communication demonstrates openness and empathy, yet they're the same words. Now let's talk about Jack and his situation. Which question would be an example of an open-ended question? What is your address, Jack? Do you often fall down the hill? What brought you in today? Or did Jill push you? The answer, of course, is C. What brought you in today? It's possible that although Jack has just fallen down the hill, that this is not why he came to see you. If it is, the question still allows Jack to answer the question and provide details rather than a yes or no response. Let's say that I have just asked Jack to tell me what exactly happened. Jack becomes silent. If you continue on the conversation, I do not allow Jack the time to formulate his thoughts or perhaps put them in sequence. This would not be therapeutic. Let's discuss one more example of communication. Reflective listening is one of the most difficult communication skills. During your appointment with Jack, he expresses concerns with his difficulty walking down hills. An example of reflective listening would be, You're concerned with your difficulty walking down hills. This demonstrates you are listening to Jack. You could also utilize paraphrasing to demonstrate that you are listening to him to discuss his issue. If I understand correctly, while you were trying to fetch a pail of water, you fell down the hill and broke your crown. Is this accurate? Although this next example is also paraphrasing, I am not taking into consideration that I am speaking with Jack and not a healthcare professional. If I understand, because your gait was unsteady, you fell down the hill and fractured the left parietal region of your skull. As patient navigators, you will find you need to utilize therapeutic communication skills daily in a variety of settings. Always keep in mind the person's role, knowledge, and level of understanding when communicating. We'll see you next week. Best wishes on the exam. If you have any questions, please email me.